Hi there, and welcome to today's Heart Health and Pulmonary Education topic cardiovascular health and the warning signs of heart attacks and strokes. We will be discussing the increased risks with heart disease, high blood pressure, and how cardiovascular disease occurs. First, we must ask, what is cardiovascular disease? It's more commonly known as heart disease, yet it affects more than just your heart, as it's been known to cause issues in our blood vessels. Cardiovascular disease is connected to high blood pressure, coronary artery disease, stroke, heart failure, and peripheral vascular disease. Once you are diagnosed with cardiovascular disease, you may be wondering, what are my increased risks? There are higher rates of heart attacks, strokes, and a narrowing of the arteries in the legs. This is why it's so important to be conscious about your heart health. Now, what exactly is happening in our body when we have cardiovascular disease? When arteries become damaged, blood is unable to flow freely. Plaque buildup can form on a vessel wall, impeding flow and increasing pressure. This plaque can arise because of unhealthy choices that we make, like what we eat or if we smoke. Now, let's go over what happens during a heart attack. During this time, there is not enough oxygen-rich blood flowing through the heart. Similarly, a blockage of blood flow to the brain can cause a stroke. With peripheral vascular disease, the circulation in the legs is very poor and can cause discomfort over time. There is good news though. You can manage your cardiovascular disease. Although there are some factors you cannot change, there are still so many ways to help lower your chances of having potential problems in the future. Our heart and blood vessels can worsen over time unless important changes are made within our daily habits. Now, here are some things that you can't change. Gender. Men's risk of heart disease rises earlier than women's risk of heart disease, but women have equal risk after menopause. Family history. If other people in your family have had a heart attack or known to have cardiovascular complications, you will be within a higher risk category. Age. Your risk of a cardiac episode will increase with age. Unfortunately, this is just what comes with aging. Now, here are some things that you can change: having high blood pressure, having high cholesterol, being overweight, not exercising, using tobacco or being around smokers, and having too much stress. It's incredibly important to make changes to address each of your risk factors. This may seem like a lot of work in the beginning, so you should try starting with one small thing at a time. Small changes can make big impacts. Making these changes are essential to your overall health. Make sure you are asking your healthcare professional how to lower your risk and how often you should return for checkups. Here, we will be discussing some of the typical warning signs for both men and women. Some people may have all of the signs of a heart attack, while some may just have a few or even none. With chest discomfort, it may last more than a few minutes or go away and come back. It can feel like pressure, squeezing, or sharp pain. With discomfort in other areas of the body, there may be some in both arms, your back, neck, or even jaw. Shortness of breath can sometimes be the only symptom of a heart attack. Other signs include having a cold sweat, feeling sick to your stomach, or even being lightheaded. Heart disease is the number one killer of both women and men. Nearly half of all heart attack deaths are women. Women and men are subject to differing displays of a heart attack or chest pain. Women are less likely to believe they're having a heart attack, wait longer to get emergency treatment, and are usually about 10 years older than men when they have a heart attack. Women are also more likely than men to have these common signs of a heart attack: shortness of breath, nausea or vomiting, and pain in the back, neck, or jaw. Women also have these less common signs of a heart attack: heartburn, loss of appetite, feelings of being tired or weak, coughing, and heart flutters. Make sure you discuss with your doctor what are the chances of having a heart attack, what your risk of a cardiovascular event is, and what steps you should take to avoid having another heart attack. Now, let's discuss strokes and how they affect us. A stroke occurs when blood flowing to the brain stops. Within minutes, brain cells begin to die. A stroke is a medical emergency. If you or someone you know is having a stroke, it is important to recognize the symptoms so that you can get to the hospital quickly. Most importantly, let's learn what the warning signs of a stroke are. Sudden numbness or weakness of the face, arm, leg, and especially one side of the body. Sudden confusion, trouble speaking or understanding. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination, and sudden severe headache with no known cause. Let's put what we have learned into action and discuss some steps to help make the process easier. Work with your healthcare team. Set goals that you think you can reach. Change only one habit at a time. Keep at it. If you slip up, just try again. Follow a plan that will work for you to help you lower your risk with cardiovascular disease. And ask family members and friends for support. Taking care of your heart and blood vessels is one of the most important things you can do for your health and overall well-being. It can take some real effort because this involves habits you have become comfortable with. This information was provided by Maine Health. Visit www.mainehealth.org to learn more. Thanks for watching. Until next time, stay healthy.